said the U.S. is. On the question of which country provides better health care, 63% of the Bay Area residents polled and 59% of the Soviets agree that the United States provides better health care. And when asked, have you always been able to get adequate health care, 83% of the Bay Area respondents and 72% of the Soviets said yes, while 24% of the Muscovites interviewed said adequate health care was not available in their country. Sylvia Chase found some real inadequacies, in fact, in Soviet health care during her recent trip to the Soviet Union. And Sylvia, how far behind are the Soviets as far as AIDS care and AIDS research?
Well, I don't think it's so much a question of the medical community, Bob, as it is, I guess you'd have to say, arcane dogma. Once again, we have a story of bigotry. It begins in the midst of rare beauty. A snowy forest on the outskirts of Moscow, a hunting ground of the Tsars in times gone by, and in its midst, a hospital where a scourge of the 20th century is treated. The Hospital for Infectious Diseases, the only place in this nation of almost 300 million where blood is tested for AIDS, or as the Soviet initials for acquired immune deficiency syndrome spell it out, SPEED. They line up to be tested every Wednesday afternoon, but we cannot show their faces. They are afraid to be identified as members of the groups at risk: homosexuals, prostitutes, IV drug abusers. Until now, the official Soviet record shows that only 112 citizens have tested positive for the virus. 3 have died, and there is 1 person in the hospital now with a full-blown case of AIDS. I want to make sure I understand. There are only 112...
Yes, 112 patients with the virus.
Who test positive?
Yes, test positive.
I can say we are probably at the beginning of the development of AIDS.
There are just 45 beds in this hospital, the only beds in the USSR exclusively committed to AIDS treatment, in a nation where the first word about AIDS did not appear in print until well into the mid-'80s. In this room, a gay man you can't see because he does not want to be seen. Fear. It's against the law to be homosexual, a crime. And though enforcement has now been relaxed, the history is that homosexual behavior in the USSR has had grim consequences. Stalin sent gays to concentration camps, women's camps. To conquer AIDS, the Soviets will also have to conquer their own prejudices, their belief that prostitution and homosexuality and IV drug abuse are products of the decadent West. And they will also have to rid themselves of a persistent homophobia. He calls himself Nora. He is a transvestite. On a Moscow street, he is quickly surrounded by the curious and hostile. Nora is asked by an interviewer if he is a man or woman. Nora replies that he is a person. Nora is featured in a groundbreaking film that was made in 1987 by the Moscow Studio for Documentary Films. It is called Group of Risk and focuses on the hidden lives of prostitutes, homosexuals, and IV drug users. The film's producers wanted to open the eyes of a society largely ignorant of a deadly disease and intolerant of the kinds of people who are at risk. In the film, prostitutes, who began their careers at an early age, like the easy money, and who prefer foreigners. Then, homosexuals, who express their fear of AIDS, but who cruise anyway at gay meeting places like the bathrooms at the Metro and the Bolshoi Ballet. And then, drug users, who cannot escape their dark and dirty world of needles and highs.
And in a very few years, to my mind, 3 or 5 years will pass, and we'll have very many infected people, and many people will die from AIDS, and many children will be born, and we'll have very serious problem with these diseases.
Leonid Zagalsky is a Soviet journalist and one of the producers of the film. He says that when the film was being made, a letter was written by 16 young medical graduates who were opposed to the battle against AIDS and wanted the epidemic to continue, to wipe out hookers, junkies, and homosexuals. The letter ends, "Long live AIDS." In spite of this, Leonid feels doctors in the Soviet Union are ready to fight the disease. It is the medical bureaucracy and the public which is not. A public saddled with an outmoded kind of sexual etiquette. For example, the use of condoms.
Oh, yes, this is a problem because there are not very many condoms and their quality is very bad. It's very low. They are not lubricated. They are very thick, and we have no traditions to use contraceptions in our sex.
Another problem, the Soviet attitude toward health care. The USSR spends just 4% of its gross national product on health, one of the lowest figures in the developed world. And a recent Soviet newspaper article said 30% of doctors are unfit for duty, but they work because of a severe doctor shortage. Basic medical supplies are so scarce that disposable syringes are used until they break, the reason for the worst Soviet AIDS crisis yet. Last week in a southern Soviet city, the news that 27 children under the age of 2 have the AIDS virus. It's been traced to a blood donor, and it was spread by the use of unsterilized needles and syringes. This tragedy may finally smash the Soviet myth that Russia is somehow magically immune to AIDS.